Hi, I'm here again with Laurence Katsarus, who's the Technical Support Manager at Ketogenic. So we've been chatting about dementia and sort of thinking about the signs and symptoms, the sort of things that people might be seeing for, around that 20 years before dementia really takes hold. There's lots of signs that might make people go, I wonder if I am in a higher risk.
Yeah, definitely, Madonna. And I think that identifying that can then help people start to intervene with that a little earlier as well. And so you tend to see the classic signs and symptoms is that people will start to have memory issues and struggle with things that they've always done before. Now, all of us can get forgetful sometimes, especially when we're stressed and busy. It's easy to kind of go, where did I put my keys or where's my glasses? But it's things that, like the classic example might be driving to a place that you've always driven to and then sort of going, I actually just I can't remember how to get there. It's this spatial memory.
Right. As opposed to thinking about something and not taking the right turn off. There's a difference.
Exactly. Yeah. It's sort of just like, it's like all of a sudden your brain just doesn't have that memory there. And so there's these changes in memory and difficulty finding those memories. Yeah. You can start to get changes in behaviour as it starts to progress. You will also start to find that then people will struggle with doing day-to-day tasks. So it might be that, they might then go to the grocery store and then forget, why they're even there. Like, this is as it starts to progress quite strongly. You can start to see changes in mood, changes in, someone might start to become maybe depressed or feeling like constantly low mood, irritable, moving towards aggressive behaviour can also be a
presentation. So why is that? Is that because the brain is shrinking, so there's less mass, or is it because the connections aren't sparking? Like, what is it that's creating the mood connection?
Really good question. So it's actually what we're finding, or what the research has been finding, is that the areas of the brain that are particularly affected by Alzheimer's disease are also the areas that not only affect our memory, but also help regulate our mood.
Right.
So there's a particular region within our brain called the hippocampus, and this area of our brain is actually responsible for memory, and also responsible for regulating our mood. So it's the area of our brain that helps provide emotional context to situations and also helps us link our emotional memories with our moods and also the situation. So an example of this is your hippocampus is what's responsible for, I remember when I was a child having, riding on the bike and I fell over on the hill, for instance, and that that then might produce a memory and maybe a hesitation riding down hills later on through your life. But when that hippocampus, from the neurodegeneration that takes place, and you actually get a shrinking of that actual brain region. So now that brain region has less neurons, so it's got less cells to actually fire and maintain those memories and draw upon those memories and utilise them in our day-to-day life, and as well that hippocampus being responsible for mood regulation. It's our hippocampus that's actually responsible for saying, I'm in this situation today, I'm a little bit upset, was in traffic perhaps, or this may have happened at work or the family, or maybe something didn't be organised the way you want it to be. It's the hippocampus that can help us rationalise that and work with controlling our mood response to that situation.
Right.
Now, with less health in the neurons, the cells in the hippocampus, less cells to actually coordinate that individual's then more prone to having more of an exaggerated emotional response to that, perhaps. Right. Or having less ability to actually call upon those memories. So there's actually changes within the brain regions because of that inflammation causing damage to those cells. Right. And so you and as well as that inflammation also affecting our neurotransmitters. I'm sure we've probably all heard of neurotransmitters before. They help to regulate our mood and behaviour.
Serotonin, dopamine.
Yeah,
adrenaline.
Exactly. Yeah. And these are what antidepressants are working on, for instance. And so those neurotransmitters help regulate our mood in different areas of the brain. They play different functions.
Right.
And as we start to become inflamed, we actually start to affect the balance of those neurotransmitters, the production of those neurotransmitters. So then someone can maybe start to feel depressed, or they can start to feel anxious, for instance. And so that's where you get this mood association, these mood disorders in the presentation of the Alzheimer's disease, as you start to see that come on.
Because under long-term stress, the hippocampus shrinks as well, doesn't it?
Yeah, exactly, Madonna. So, under that, you'll see a similar effect in change in that hippocampus from someone under chronic stress.
Right.
So someone who's been burning the candle at both ends, very stressed, you can start to see similar presentations. Now, I'm not saying they're getting the same degree as Alzheimer's disease, but as we all feel under stress, we start to be a little bit forgetful. Our mood starts to become a little bit destabilized. We have less trouble being able to say, oh, this situation is stressful, but it's okay. We start to fly off the handle.
Right.
So it's because you've got the same effect in the same, or a similar effect probably in the same brain region. It's just nowhere near as severe.
Right. And there are some links with some medications and memory loss as we get older?
Yeah, so there are some findings that are starting to come out now where you're seeing that particular medications can be increasing the risk factors for dementia, and so certain medications for blood pressure can be associated with that. I believe there's also links with medications for cholesterol for increasing the risk factor for dementia as well. And so what we're doing with these medications is we might be decreasing a symptom, say, in the cardiovascular system like blood pressure or cholesterol, but that process is all part of, it's being generated by an underlying inflammatory process. So what's causing the blood pressure can potentially also be what's causing the Alzheimer's disease. And then the reason why some of these medications can increase the risk factor for Alzheimer's disease is because you can be starting to get rid of you can start to affect the balance of that neurotrophic factors to help balance and grow new nerve cells.
No, we're not telling people to go off their drugs.
Not at all.
No.
Like, those drugs are necessary, and those drugs are helping to keep people alive and keep them healthy.
Yes.
But I think it's being aware of the risk factors that are there and saying, okay, well, this might put me at risk of that. But so first and foremost, it's making sure that's appropriately prescribed and that they're used appropriately, and then saying, okay, well, I can offset that. And I think that really from the findings that are coming out from Dr. Dale Bredesen, we're seeing that this is a treatable condition. Like, it was once thought that essentially Alzheimer's disease was a death sentence. It was like, once you've got this, we're sorry, there's nothing that we can be doing. The standard medications that are used for Alzheimer's disease aren't able to reverse it. They're actually just able to try and slow down the process of the cognitive impairment.
And it is increasing at a massive speed in Australia, isn't it?
It's increasing at a phenomenal rate. Like, I think the stats are you're seeing that by 2025, I've got here that we're actually going to start to see that without a medical breakthrough, we're actually going to reach over like 1 million individuals and by 2056.
Wow.
And by 2025, we're actually going to start to have, like, currently we've got more than 400,000 individuals in Australia, and by 2025, that's going to increase up to over nearly 550,000 individuals.
Me.
And it is said, and this is where there's a huge concern, it's in other developed countries at the same rates, is that it will break the bank. Like, we don't have a medical system that can keep up and care for and provide the support for individuals with dementia.
Yeah.
And so we see this being a major public health issue. Like, it affects individuals and it affects families dramatically.
Yeah.
And seeing an individual go through that is horrible.
Yeah.
Then that places a greater impact on society and a global financial risk there. And so there is a lot of reasons for why we really need to start to address this from a personal level and from a social perspective as well.
So what can our loved ones do now? So those people in our world who we either suspect they're getting dementia or they're starting to get the signs or they've got it, what can we do now to really start turning this around for people?
Really good question. So they're identifying an at-risk individual. So when you're seeing these signs and symptoms and saying, I think, your memory doesn't seem to be the same as it is. There seems to be some changes in mood. Identifying risk factors like, has this individual got diabetes? Have they got an inflammatory condition like we talked about, autoimmune conditions, osteoarthritis? I mean, pain is a symptom of inflammation. So have they got chronic pain and inflammatory conditions? We would be seeing that, is this individual got hormonal disturbances? Have they got a history of smoking? High homocysteine, which is a marker for cardiovascular disease, is also a high risk factor for Alzheimer's disease.
Yeah.
You can be testing a gene called apolipoprotein E4, otherwise known as ApoE4, and this is one of the best genetic risk factors for Alzheimer's disease.
Is that something that can be done through the GP?
Yeah, that's something that the GP can be doing.
Yeah.
Looking at family history will give you a bit of an indication, so you might start to see that one of your parents or one of your grandparents or your partner's parents or friends had a history of dementia, so you go, okay, well, potentially there's a genetic risk, but knowing that there's also some subtypes of Alzheimer's disease that aren't based in genetics. But then going to the GP and going, can I get ApoE4 done? Can I get homocysteine done, which is commonly done for as a cardiovascular risk.
Yes.
You can be testing inflammatory markers, which is often done through the GP for chronic inflammatory conditions.
Like CRP.
CRP, C-reactive protein, is a good marker of inflammation, and you're seeing that high shows as inflammation that could predispose an individual to it. They see associations with low vitamin D. Vitamin D is not being commonly tested now because it's just established that a lot of us are not getting enough vitamin D. But
so why bother testing?
Yeah, so why bother testing?
So what levels do people need? Because I know it only shows up to 50, is the low level that...
Yeah, often, when I'm testing vitamin D, I see a lot of people sitting around 50. Now, that's the lower cutoff level of vitamin D.
Yeah.
It goes up to 100, 150. The ideal levels that studies are showing, there's a lot of evidence showing the benefits of vitamin D in so many different disorders, and one of those being dementia, about
Yes.
how protective vitamin D is. And the reason for that is it balances up that balance of growing new nerve cells in our brain and decreasing the preening and the neurodegeneration.
Yeah.
So the levels that you want to actually be looking at, studies show ideally 100 to 150 nanomoles.
Oh, wow.
Yeah,
Okay.
and most people see about, you've got about 50 or 60.
Yeah.
And
I get a lot of clients who sort of say, well, I spend lots of time in the sun, but then their levels are low in the blood. And I say, yeah, but what's your vitamin D doing? If you have a high need for vitamin D, then it's going to get chewed up at the speed of light. It's not going to keep... So they need to be supplementing if the sunshine isn't enough.
Definitely. And I mean, up here in Queensland, we have the advantage of being able to get sufficient sun at the right kind of level coming through the atmosphere. But also the science shows that as we age, we stop synthesizing as much vitamin D.
Right.
So as an elderly individual, they might be out in the garden doing their gardening, getting a bit of sunshine, but they might not produce as much vitamin D from that as their grandchild would be if they're gardening alongside them.
Right.
Yeah.
Higher risk factor again.
Exactly, risk factor. And so we were talking, I guess vitamin D, something, CRP, homocysteine, testing ApoE4, looking at the individual. I mean, that's all kind of, you'd be seeing the GP for. Looking at the individual and saying, well, okay, do you smoke? Are you overweight? Do you have a sedentary lifestyle? How often are you exercising? Do you have a history of diabetes? These are all risk factors that have been associated with Alzheimer's disease as well.
Right.
You're seeing that in someone where you start to go, hang on, there's problems with their memory, their tasks that they could always do before, things that they never had issues with, calling... the example might be using phone numbers. I find that's difficult now because everyone has it in their mobile.
Phone,
but
yeah.
Maybe knowing, maybe writing a letter and struggling with the address, or
just not having those words on the tip of your tongue, or
yeah, definitely.
And what's my son's name?
And that's a great example, Madonna. I think things that should be really easy and that you've never struggled with before, and starting to go, oh, hang on, seeing that alongside some of those. Lifestyle risk factors like diabetes, increased weight, sedentary lifestyle, smoking, then it's like, okay, well, let's send that person along to the doctor. There's some easy tests that they can be doing in terms of memory recall tests. Then they can be looking at doing blood tests and then start to find out. And I think that's where the work is then showing from what Dr. Bredesen's saying, is that it's good to know early. There's no point burying your head in the sand, because we can start to work with that. And what his work shows is he's been one of the first to actually document that not only can you stabilise this, but he's been able to reverse it in individuals.
Which the drugs don't do.
No. And the drugs really just look at best stabilising or slowing down the progression. And, it just delays the inevitable.
Yeah.
Where what we can really be doing is trying to help that brain stop what's driving damaging it.
Yeah.
And help switch on that growth for that brain again.
Yeah.
And there's a lot of things that are, natural ingredients that have been found to be able to do that.
So like what?
So there's a lot of evidence coming out, and this has been there for a while, about fish oil, EPA and DHA.
Yeah.
But when we're talking about fish oil, one of the things I see most is that people need to be getting good amounts of it. So eating fish isn't necessarily...
And non-toxic.
Exactly. Non-toxic, quality fish oil.
Yeah.
Like with most things, you get what you pay for.
Yeah.
If you want to try and get a cheap fish oil and you're paying $10 and you might be picking that up and it's a tub of 1,000 capsules or something. The quality is just not going to be there. It's just the same as in everything else. I heard this described the other day by a practitioner saying it's like cheese. You go to the supermarket and you can pay $2 for a block of cheese, or you can pay, cheese, you've got cheeses, up to $100 a kilo. But say you're looking at good cheddar, you got $2 for some cheddar, or you could be paying $10 for some cheddar. You see the difference in those cheeses, right? They're both still technically cheese, but there's a very big difference in the quality of that product. The same thing with fish oil, and I find that's very common in my patients, is educating them and say, get good quality fish oil. So fish oil, the EPA and the DHA, making sure they're getting sufficient doses of that.
So EPA is more anti-inflammatory, the DHA regenerates the brain, it's more to do with brain growth, or?
Yeah, there is this general association that fish oil is made up of the two components of different fatty acids, EPA and DHA. EPA tends to have a more anti-inflammatory aspect. DHA tends to be used for more of our cognition and integrated into the membranes of our cells and our neurons.
Right.
So DHA is a little bit better for cognition, EPA is a little bit better for inflammation. Now, given that we're talking about an inflammatory condition of the brain, you're wanting both of those there. So generally looking at doses of up around a gram a day of the DHA. And again, this is where quality fish oil comes in, because to get those kind of doses of cheap fish oil, someone might be taking 19 capsules, and no one wants to do that.
Yeah.
So EPA, DHA, we also see in other oils that you can get are these things known as phospholipids. You can get these from foods as well. You can get some of these, say, from eggs, getting phospholipids. And these phospholipids basically work to integrate those fats, EPA and DHA, into our neurons. Because our neurons, you almost think about them, they want to stay nice and moist and coated in these fatty acids.
Yep.
If they start to then become dried out, this is a simplification, they can start to become rigid, and they can start to then become more prone to damage.
Right.
And so you want to make sure that we're getting enough fatty acids there. And I think the studies show that about a third of individuals in Australia, no, it's 20% of individuals in Australia get enough EPA and DHA through their diet. So most of us aren't getting it through our food. So we really need to be looking at supplementing it. That will decrease our risk through our life, but certainly someone who we identify as being at risk. We've got EPA, DHA, you've got phospholipids, you've got herbs. Turmeric is becoming huge on the market for inflammatory conditions. A lot of us might be using it for osteoarthritis. Because it's an anti-inflammatory, it's also beneficial for decreasing the inflammation driving Alzheimer's disease and dementia. And there's studies that are coming out using a particular form of turmeric, of BCM95, which is available here in Australia on the market, and that's been looking at being trialled to help improve dementia.
Right.
And because of its effects, that not only does turmeric work on decreasing inflammation, but it's a wonderful herb that actually traditionally has been used in Ayurvedic Indian medicine for cognitive impairment, mood disorders, and it helps specifically with enhancing those brain regions such as the hippocampus that we talked about before.
Protects our genes and things too, doesn't it? It does a massive amount of things.
Oh, it protects our genes. Some of us may be familiar with like you've heard about the research coming out on our gut health and our microbiome. Turmeric enhances the health of our microbiome. It helps us grow the right kind of bugs there.
Beautiful.
That helps coordinate our immune system, our inflammatory system, also our mood. So turmeric has been shown to have some great effects. Look, dosing on turmeric, on BCM95, they've been looking at 12.5 grams a day up to 25 grams a day.
Right.
Is really where you're looking at having mood stabilising effects. 25 grams a day is where you're having a more marked anti-inflammatory effect.
Right.
Other factors you've got is just good old B vitamins. Really important for making sure that we're maintaining the right kind of cellular health and neurochemistry that we need to maintain the balance within our brain health. Of course, vitamin D, if it's low, and what other elements are there? Herbs like ginkgo and brahmi have been shown to have an effect.
And been used for
thousands of years.
Yes.
So, just like turmeric, these are things that have been used for that traditional presentation.
Yeah.
And they work. It's fascinating now what science is showing, where these herbs that we've always used, now we see exactly why they were used for that.
Which is great.
Yeah, it's phenomenal. Yeah. And then outside of that, it's really probably about addressing what's going on with the different subtypes in that dementia, is it the glycotoxic? And in which case you look into things like chromium, lipoic acid, trying to help diet stabilize that in that individual, as opposed to maybe the toxic, and you might be looking at that person trying to help the detoxification of that. Now, outside of good old supplementation, of course, we've got simple dietary and lifestyle factors.
I was about to ask that actually. So there are things that are definitely degenerative for the brain that we're eating. Things like sugar, high levels of stodgy carbohydrates.
Yeah, and not only does that just predispose you to the diabetes and then that potentially glycotoxic subtype of Alzheimer's disease, it's that those sugars in all of us can, by causing an imbalance to our blood glucose levels, can cause a very big cascade of side effects, which essentially simply just lead to inflammation.
Yeah.
So removing out those simple carbohydrates, so we're talking about the rices, so the white rices, we're talking about potatoes, we're talking about pastas, we're talking about breads. These are the things that are actually driving these inflammatory conditions. So most of us should be trying to limit those. We want to be increasing our plant-based foods, because in those plant-based foods we get these things known as phytochemicals.
Right.
And that's what actually communicates with our cells, and they'll help to decrease the inflammation. They'll help to enhance our cellular repair. And there's a lot of evidence that's showing that now about the benefits of eating a plant-based diet. And it's actually...
And the colours of the rainbow, increasing the colours.
Yeah, exactly. We always sort of talk about try and get all the colours of the rainbow on your plate.
Yeah.
And then because it's those phytochemicals that are actually involved in those colours that are there, and different colours have different phytochemicals. So you eat a different rainbow and you get that broad phytochemicals. And that's what they see is beneficial in an organic diet. Is not necessarily that the minerals or vitamins are different, but the substantial increase in the phytochemicals of an organic diet. And potentially that's where the benefits of an organic diet are coming from. So looking at eating plant-based foods, look at limiting the simple carbohydrates, starchy carbohydrates, looking at eating, getting your oils through there, so avocados, nuts and seeds, or eating our fish. Be careful with our fish though, we want to be eating our fish and getting our fish oils.
Yes.
But being aware that when we're looking at larger fish such as tuna and salmon, salmon, for instance, a lot of this in Australia is farmed, and it's being fed, not a great diet. It's not then, it's being exposed to toxins. And the reason why these larger fish are a problem is because of their life cycle. They retain more toxins.
Right.
And then we eat those fish, and then we get those toxins.
So the better fish to eat?
The better fish to eat are the smaller fish that are high in EPA and DHA. Your smaller fish such as anchovies and sardines.
Yep.
They're small and they're rich in these fatty acids. Still, look, enjoy a nice steak of tuna, or salmon, but I wouldn't try to encourage eating high amounts of that every particular day, because you're also going to get a couple of unwanted nasties through that.
Yeah.
Exercise. I can't stress enough the importance of just regular movement and exercise.
For the neuroplasticity.
Exactly. Yeah. It helps enhance that plasticity.
Yeah.
Studies have shown that in an elderly population, over the course of a year, they got them to exercise 1 hour a day through a simple 1 hour walk, 5 days a week. And over the course of that year, they actually grew their hippocampus. And that hippocampus being responsible for mood and memory.
And that's just walking for elderly people.
Just a walk. So you get a couple of you together, go for a little walk, maybe walk your dog, go for a walk through the park. Yeah. And you're not seeing immediate results with this sometimes. It will take a couple of months of eating well and exercising. People will start to notice a difference. Mental exercise as well. Challenging our brain. What enhances neuroplasticity and nerve growth within our brain is challenging that brain. So continuing to learn. So you've got fantastic apps out there, like you've got Luminosity, for instance. You've got all these mental apps on phones. If we're not technologically, using our smartphones, for instance, crosswords, Sudoku, playing, mentally stimulating games with our family. It's a great way together to build our connections, have fun, but also challenging our brain, learning new languages, doing crafts. These are things that can help us, any kind of mental stimulation helps us grow our brain and helps that balance of neurodegeneration. So physical exercise, keeping active, keeping mentally active as well.
Yeah.
Eating a good diet, plant-based foods, restricting your carbohydrates and restricting your sugars, as much as we might all love a cup of tea and biscuit, really trying to keep that to a minimum.
Yeah.
And not have it as the norm.
And start trying to find snacks that are healthy for you. You know, making protein balls or doing something that will actually feed your brain rather than deteriorate it.
Definitely. And I think now it's easier than it ever has been. We've got more health options on the market.
Yeah.
You've got people producing good cookbooks. There's these recipes online. There's seeing it in the cooking shows online, on the TV, of just healthy options that are lower in sugars. And utilising those. And what I find is that the first couple of weeks can be difficult adopting a new diet. Start small. Just try and do one change at a time. That's all I do with my patients.
Yeah.
And then in a couple of weeks, all of a sudden people say, you know, it's not that hard. It's just changing what we're used to. Changing, you know, we're creatures of habit.
Yeah.
As you change that, it can be a bit of a struggle, and then you become used to, you're going to go for your walk, you go for your walk in the afternoon, and then you stop somewhere, and then maybe you have a nice healthy snack, and, you know, that becomes the norm for you.
Yeah. Actually, was the ketogenic diet one of the things they were looking at for dementia as well?
They've done studies on the ketogenic diet, and so what they can find is the ketogenic diet can produce some benefits.
Yeah.
The Mediterranean diet's probably been shown to have the best benefits, especially in individuals that have been shown to be positive for that genetic risk, that ApoE4, which is the genetic risk factor for Alzheimer's disease we talked about. Interestingly enough, if you have that genetic variant and you have that risk factor, those individuals respond best to dietary and lifestyle interventions. So you want to know about that and be equipped with that knowledge, and then go, okay, I'm actually going to respond better to eating a Mediterranean diet, which is looking at good amounts of plant-based foods, some whole grains, some, you know, oily fish, moderate protein, and, you know, reducing those carbohydrates.
Right.
And I'm going to respond better to an exercise program, as we talked about.
Yes.
And by exercise, we're talking about, you know, walking, getting out in the garden, keeping active.
Yeah.
And I'm going to respond better to supplementation with things like fish oil.
Right.
So you want to know about it, and you'll actually respond well to it as well.
Well, that is fantastic. I hope that's been really interesting for the listeners. Is there anything you would like to sort of say to finish off?
Look, I think that probably just in closing with this is that knowing that Alzheimer's disease, dementia, it's not a death sentence. Evidence is starting to show now that we can address it, but we address it not just by one particular thing, through one particular drug. We address it through a holistic support for the whole individual. Addressing what's going on that's affecting the health of that individual, and then working with diet, lifestyle, exercise, basic supplementation, and then, of course, some medications will be required alongside that. So we want to know about that early so we can support that in that individual, and I guess being aware of this for our friends and family, and then pointing them in direction of someone who can help them with that. And I think naturopaths are positioned well that can help with the diet and the lifestyle, and going, what's going on in that individual's health? How can we support you as an individual? And how can they then work with the GP to make sure that their more serious health needs are being addressed with their medications, but the naturopaths can be working with the individual to go, here's a diet that works for you, here's a lifestyle, and help them implement that. So I think that knowing that it's can be restored, but it can be restored through a holistic support for the health of that whole individual is important, and getting onto that as early as we can be.
Yeah. Well, that's fantastic. Thank you very much.
Thanks very much.
Excellent.
For
Thank you.
Thanks for having me on the show.